beginning of the pandemic, we had to address both the immediate as well as persistent health and economic impacts of the pandemic. Our response was bold, decisive, and compassionate, but also costly. As a responsible government, alive to the concerns of the people, we have had no choice but to implement critical interventions to take lives and to save lives and jobs, including feeding nearly 2.8 million people with hot meals. We also collaborated with our faith-based organizations to provide 470,000 families with food packages. Mr. Speaker, to mitigate the health impacts of the pandemic, government also employed additional 38,000 nurses. Tax exemptions worth 36.8 million Ghana cedis were also granted to our frontline staff, while 10.1 million and 4.78 million households were provided with free water and electricity, respectively. To facilitate the mass reopening of schools, government provided 11 million students and staff with essential supplies such as face masks, paper towels, liquid soap, and sanitizers, all at great cost. Cooked meals were also provided to final year JHS students in both public and private schools. Mr. Speaker, these have been expensive, but we knew that the cost of doing nothing and disrupting the education of our children for an entire academic year would have been even greater. I'm proud to announce that not a single Ghanaian public sector worker was laid off as a result of the impact of the pandemic on our public finances, and we have managed to pay them monthly, and we are grateful to the unions for their cooperation in this regard.